Welcome back to the show. So an increasing number of young people statewide are now being hospitalized with COVID. And sadly, a child died from the virus at a Seattle hospital this past week. Now, with schools returning to in-person learning, I checked in with Dr. Elizabeth Meade at Swedish Hospital about what us parents need to know.
I mean, this is scary. When the pandemic was happening, the one thing that kept, I think, most parents from going crazy was that COVID didn't seem to be affecting children as much, but that's not the case with this new Delta variant. More children than ever in the hospital during the pandemic. What has changed?
Well, I think the good news for parents is that in terms of the percentage of kids that we're seeing get really sick, so out of all the kids who get COVID, who test positive for COVID, that percentage of children who end up really sick in the hospital, in the ICU, is still the same with Delta variant. Okay. I think the difference is so many more children are getting it because the case numbers are just going up and up and up across the country. So we're seeing those absolute total numbers of kids who are hospitalized who are really sick go up as well.
Right. So is it just more contagious or is it harder on these kids?
It's more contagious, it's more transmissible. And so again, those overall case numbers are just rising and rising. So if you think about it, if only 2% of kids with COVID get really sick, 2% of 30,000 cases in a week is much different than 2% of 180,000 cases in a week. And so unfortunately, our pediatric hospitals, units, and ICUs are also seeing this significant increase in COVID patients who are under the age of 18.
You are the chief of pediatrics at Swedish. What are you seeing there?
Yeah, at Swedish, we've had a very variable census. The pandemic has been really interesting. So for quite some time, we were seeing much fewer kids than normal because kids weren't getting flu and RSV and all of the other things that they typically get in the wintertime. Mm-hmm. Our numbers have certainly started to go up, and we've had a very busy summer compared to normal. Many hospitals in the region, including Seattle Children's and Mary Bridge, are also seeing very, very high patient numbers, really out of proportion of what's typical for summertime.
That's kind of scary. Another scary thing is, I think, how do you know? Because, kids don't always communicate in the way that adults can. So does COVID present itself differently in children than it does adults? Is there anything we should be looking out for specifically?
Great question. It can be really variable in kids. So similar to adults, lots of kids will have just a mild infection. So it may just seem like a cold, but with any illness, really, I think parents know their kids best. So if you think that your child just seems off, if they're not acting like they typically do, if they're not interacting with you like normal, especially for those younger kids and infants, that is always a sign that you should get them checked out. And then for children, the other thing we can see is this multi-system inflammatory syndrome. So those are kids who are coming in with fevers, lots of organ dysfunction, lab abnormalities. That's something that really has to be diagnosed with a physician. So if you're suspecting that your kid has COVID or has been exposed to COVID and is exhibiting signs of illness, definitely get them checked out by a doctor.
Yeah, this multi-system inflammatory thing, it's what keeps me up at night. But yeah. Again, this is why we're talking to you, so that we can not be scared, but be informed and take the right precautions. Speaking of which, children under 12, not ready for the vaccine yet. It's still not approved for kids under 12. But yet school's coming back, activities are coming back. So how should parents be navigating the start of the school year?
Yeah, this is so tricky. And we have a 6-year-old at my house who's going back to full-time school for the first time ever, really. He was in kindergarten virtually for most of the year last year. So I absolutely understand all of these questions and concerns. I think everyone is really having a hard time grappling with this. And we are also all having a lot of decision fatigue, right? So every time we're making one of these decisions for our kids, it just feels like life or death. And in some situations, it certainly can be. I think what we know from our experience last year here in Washington is that going back to school, we saw could be done very safely. So when we layer all of those preventative strategies, we're talking about universal masking, getting kids vaccinated who are eligible, getting teachers and staff vaccinated, physical distancing, hand washing, all of the things that we're talking about, those ventilation and kind of outdoor times, and really limiting that unmasked indoor contact. Okay. All of those things have worked very well in limiting transmission in schools. Now, we are starting to see across the country, particularly in places that are not doing universal masking and have lower vaccination rates in the community, that those school transmissions are going up. So I think we need to pay really close attention to this in our area as we start and go back this fall, and just be willing to change our guidance if it looks like the data is changing.
What do we see as the future of kids under 12 getting the vaccine? I mean, are we going to have to wait till it's FDA approved? Do you have any idea about how the clinical trials are going with it?
All of the data that we've seen so far suggests that it's also very safe and very effective, but we still need to see that full safety data from the manufacturers. So we were initially hopeful that might happen kind of September, October. I think it's looking more like it's going to be the end of the year. So kind of December-ish, somewhere in there. I know that many parents are desperate to get their younger kids vaccinated, especially parents who live in a household where maybe one child is old enough and one isn't. And we're sort of all having to behave as if none of us are vaccinated if we have unvaxxed kids in the house, right? And so my hope is that by the end of the year, I know people are really anxious for that to happen.
And I know there was a lot of information packed into that interview. We'll have it up on our website later.